Hypertension is abbreviated as HTN and is commonly referred to as high blood pressure. It's a common condition in which the force exerted on the walls of the arteries by the blood consistently exceeds normal ranges. Affecting 1 in every 3 Americans, I can guarantee that you'll come across hypertension in your documentation. There are 2 types of hypertension, primary and secondary. Primary hypertension, also referred to as essential hypertension, tends to develop gradually over the years and is idiopathic, meaning that it arises spontaneously and without a known cause. With secondary hypertension, also referred to as inessential hypertension, the cause is known and it may develop rapidly. Some examples include kidney disease, thyroid disease, obstructive sleep apnea, pregnancy, congenital birth defects, and the use of certain medications or illicit drugs. It's important to know that many people with hypertension remain asymptomatic and therefore go undiagnosed. With that said, some report symptoms. These often include headache, shortness of breath, nosebleeds, and dizziness. Over time, the constant elevation in blood pressure can cause damage to the vessels and the organs. Luckily, hypertension can be easily detected and controlled if the proper treatment is given. Blood pressure readings measure systolic blood pressure, the larger number, and diastolic blood pressure, the smaller number. Major blood pressure stages can be seen here in this table created by the American Heart Association. Keep in mind that anything less than 120/80 doesn't truly mean that the blood pressure is normal. Once we go below 90/60, we're entering hypotension, but that's another topic entirely. Hereditary and physical risk factors for hypertension include a family history of hypertension, old age, and African ancestry. Gender also plays a role, as men are more likely to be diagnosed with hypertension before the age of 64. Modifiable risk factors include chronic kidney disease, diabetes, a poor diet, especially diets that are high in sodium, a lack of exercise, tobacco use, alcohol use, and an abnormal level of stress. Uncontrolled hypertension changes the blood vessels, causing them to become thickened, weakened, narrow, or torn. This can lead to myocardial infarction, stroke, aneurysms, kidney disease, vision loss, and vascular dementia. Hypertension affects each individual differently, and the level of documentation that is needed can be intimidating. As with any patient, pay close attention to the patient's past medical history and active medications. If the patient presents with a hypertensive emergency, frequent updates on the patient's status should be documented. Small episodes of high blood pressure are common, especially in times of stress or when we're in pain. Sometimes even the presence of the clinician in the room is enough to raise a patient's blood pressure. Distinguishing between a benign episode of high blood pressure and undiagnosed hypertension requires monitoring over time. For this reason, patients with abnormal blood pressure readings in the emergency department are often provided education on hypertension and asked to follow up with a primary care provider. Be sure to document this discussion between the clinician and the patient in the medical record.